My name's Alicia Desereau. I first came to Amy probably about 2 years ago. I'm a runner, so I had hurt my foot a little bit, and I was kind of getting the runaround from doctors as far as what was causing it, how it was getting there. And actually, I had met Amy in passing years before and said, enough with in-network situations. I'm gonna go talk to a fellow athlete who caters to athletes and hope that, she and I can have a conversation. We'll get to the bottom of it. For previous times that I've gone to physical therapy, what I've noticed is that with in-network physical therapists, they really have to treat the specific injury that you're dealing with. Where as a runner, sometimes those injuries, that might be what hurts, but that might not be the source of what's going on. So what I noticed the difference with Amy is that, yes, we talked about my foot that happened to be injured, but we dealt with it from my knees to my hips to everything that was all intertwined, and we didn't have a cutoff of what we could and couldn't talk about. So specifically for me, I really benefited from manual therapy from Amy. She's manipulating my entire body, things that I can't do by myself. I really appreciated that. I also had some things going on with my ankles that's really hard to do by yourself. So she was able to kind of manipulate my ankles, which helped a ton. So that was great. I did have moments throughout the summer that I worked with her that something else might come up in a little, not an injury per se, but like something hurt a little bit, but I knew I was able to figure out where it might be coming from. So she gave me the tools to learn how to listen to my body even more. That fall, after I worked with her during the summer, I PR'd in my half marathon, which I wasn't even sure that I was gonna be able to run that half marathon when I started that spring. So that was fantastic, but also I think I wasn't necessarily a return to sport athlete like she does have. Sometimes as a runner, you just kind of need that check every once in a while where things just hurt sometimes. And it might not necessarily be an injury, but it's something that you can just kind of tweak, and having a physical therapist in your back pocket, so to speak, has been really nice. My foot was related to my ankle and vice versa. Some of my mechanics in the way that I run, and also some of my mobility along the way, to be able to get those tools to kind of figure everything out, essentially from the hips down. I think outside of sport, what I appreciated most about coming here was, number one, that Amy's also an athlete, so she understands how we work. She understands how our brains function, that we're a little bit type A, we're a little bit OCD, we want to be the best at what we are, but also we dove in just in conversation. We dove in about nutrition a little bit more. She helped me with some supplements that might benefit me over others that I might not be taking. So things that all come together in the long run, but that a normal physical therapist wouldn't necessarily talk about with their patient. Investing in this cash-based model was so important to me because I knew it was going to get me answers, but I also knew that it was something that was a long run type of approach where, especially, I keep saying as a runner, but as a runner, those injuries just kind of pop up here and there. You want someone that knows you and knows your body and understands how you work both physically and mentally. And you don't necessarily get that from everyone. I would certainly recommend another runner to Powers Performance because I think, like I keep saying, you can't necessarily get this from normal physical therapy. I think for a lot of runners specifically, when injuries pop up, you're gonna go to the doctor and they're gonna say, stop running. Well, when I first went to Amy, she didn't say stop running. She said, let's keep running and figure out how to fix injuries along the way, which is what every athlete wants. We don't want to be told to stop. A lot of it was being able to talk to a like-minded individual in the middle of my sessions. She understands how athletes work. She understands the ins and outs. And I think for some athletes, myself included, that we forget about the little things like nutrition, like supplements, like water. We forget about all of those things and we only focus on the performance of our sport in general. So I think to talk to someone through all of that and all of the pieces was really eye-opening, and you're able to translate that into your real life. In one sentence, my experience at Powers Performance would be that Amy is the teammate that you didn't know you needed. She sees you as an athlete, but she sees you as a person. She's in your corner from start to finish. You know, when I ran my half marathon after I was done working with her, she was one of the first people to text me and ask me how it went. You know, she was so excited for me, and you don't get that from anyone, never mind the medical industry in general. It was fun. I enjoyed coming. It wasn't a project. It wasn't, you know, a chore that I had to do. It was fun to come here for an hour and hang out.
My name is Emily DeGeorge. I'm from Agawam, Massachusetts, and I go to Bryant University and play lacrosse. I have been dealing with a knee injury for, I would say, a couple of years now, where it was just always hurting, like, didn't know what was wrong with it. I was always running, training for my sport. This was happening throughout the summer, and I just didn't really know what was wrong. I kind of just went along with it. I was like, maybe I just need a day off. Would try to go here and there with that, and it just kept getting worse. So I ended up going to the doctors, and they kind of brushed it off, and it was like, oh, you just need to rest, like, just need to recover, like, give your body a rest. So I was like, okay. I did that. Nothing was really working with it, but I still didn't think much of it. Flash forward to this summer, or last summer I should say now, where I was going into my junior year of lacrosse, and I was training at TFP, which is the gym me and Sophie go to together, and it just kept getting worse, my knee injury. I just felt like nothing was working, and I didn't know what to do at that point, so I ended up going to the doctors again. I actually hurt my other knee during my sophomore season of lacrosse, so it was a follow-up, and I told him, I was like, oh, my left knee is still not feeling good. I took like over a month off after my season to try to recover my other knee, and I was like, something is just not right, and I am always go, 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 so when I was trying to like take a step back, I was like, okay, something has got to be wrong. So he kind of, once again, told me it was just like patella tendonitis, kind of was like, just rest, brush it off again. At this point, I was very, very frustrated. I didn't know what to do anymore, because I was like, I tried to go to people and they're just telling me to rest, do what I've been doing, and nothing's working. So I went to the gym the day after, and my trainer asked me how my appointment went, and I was almost in tears to him, like telling him how it went, and I was like, I don't know what to do at this point. So he recommended me to Amy and was like, I'll give her your number, tell her what's been going on with you, and try to just set the two of you up. So then I had a phone call with Amy and kind of just told her my story, what was going on, and I just never felt so heard. Like, she was like, wow, that is not how it should be in the healthcare, and come in, I want to like evaluate you and see what's going on. And that was the beginning, or that was during the summer, so I was already stressed enough about trying to get back to school, dealing with an injury, and like being ready on time to be ready for my fall season. And I ended up having a partial tear in my patella tendon. So I did not play in my fall season, but I've been trying to recover and get back, so I actually have my spring season. I was honestly very excited and just very happy. Like, I remember getting off the phone with her and talking to my parents and was like, I think this is going to be a good decision. And honestly, they want what's best for me, and they know what I've been going through as well, so they just wanted something that would work for me. And I remember being very excited because I was just like, she gets it, she understands, and she will help me figure out where I need to be. I remember Amy came out with the BFR, and before doing anything with it, she explained what it did to me, what it would do, how it would help me in the recovery process, and just everything about it before putting it on. And I feel like I'm very interested in that stuff, where I kind of want to know what's going on before I do it. So I use the BFR a lot, and I would also use it on the bike. I remember doing sled drags with certain squats, all that. And I was very shocked with what it did and how it worked, because like Sophie said before, I never expected PT to feel like a workout. Where I remember walking out of here and I'd be like, wow, I'm tired. Like, that was a lot more than I thought it was gonna be, because I just never thought of it like that. So using those different types of tools like really made it a workout and made it a challenge. I think I finally understood what recovery was like and what I needed to do to get myself where I needed to be. I was, like I said before, I feel like I'm always a go, go, go type of person, and I never want to stop. So I think coming here made me realize, like, okay, we can take a second, understand what we need to do, and go from there. because I just always think I never want to be out of shape. I never want to like backtrack, but I was backtracking in the process because I wasn't doing what I needed to do. So coming here made me understand like what needed to be done and how to do that. Even in like day-to-day activities, I've just felt improvement in that. Like I was to the point where walking up and down the stairs would hurt me, like walking around, going for a walk would hurt me. So I think strengthening my knee and understanding what would strengthen it, like isos and all those type of things, those really helped me. My mobility has gotten a lot better. I feel like I've understood the importance of stretching and what that does for your body. So I think that's helped me a lot as well, and just understanding like what I'm doing and how it will help me. So like I said, with like strengthening in my knee, I feel like I would never think certain things I had to do in here would do that for me, but it did. I'm 20 years old. I should not be having pain going up and down the stairs. Like I should not have pain running around. And I think that was also a breaking point for me of like, wow, I need to figure this out. And I just remember like feeling over the summer, I just was like, I have 2 years left to play lacrosse. Like I do not want to be in pain for these 2 years. Like obviously it's hard and it's a lot, but playing in pain is not fun, and I just wasn't almost enjoying it as much because I was always in pain playing. My confidence has improved a lot, and with any injury, like I feel like ability just, it was not there. Like I remember over the summer, I feel like I was always down on myself because I would always be happy when I was playing lacrosse, when I was running, when I was doing what I needed to do. And that was kind of taken away, and I had to take a step back. So I feel like I was really down, but then like Amy came in and she would know when I was down, and I always had a lot of questions of like when I could be back, what the process would be for me. And she kind of just like knew how to like calm me down and like redirect myself and understand like what I'm doing and how that's going to help my process. And I think she made me realize like this is going to be not like a long process, but it's not going to be fixed by tomorrow. Whereas she just kind of calmed me down, just made me feel heard and like understood what I was going through. It was also a confidence booster, I think, too, because when I came here, I want to say it was August, so I was going back to school in September. So I was not feeling very confident of going back to school, like trying to get into my season. But by the time I got back to school, I feel like even though I wasn't playing, I was confident I was going to get better for my spring season. It's definitely worth it and definitely worth looking into. You're not just a number, you are very much heard, and she understands what you're going through, and you can text Amy anytime and she will respond, where it won't take a week for her to reply like other places might. But she was just very, in this type of PT, like just very much heard is what I would say. Like I said, you're not a number. They're not just trying to take your money. They want you to be better and they want you to get back on the field. I would come in a lot with questions about that stuff, like what I can do off the field to make my recovery faster. And I remember she gave me a lot of supplements when I was here. The first couple of times I was here, of how this would improve my knee, how this would improve my health and my recovery. I think every aspect besides the physical, like you just gotta like take in almost and understand how that helps the physicality of everything. Like mental, nutrition, it all ties together. And I feel like I never realized how much that tied in until I was here. I always just thought of it as a physical thing. Like I never thought nutrition was going to be helping my knee. Like I just never thought of it like that. And like physicality always comes with a mental thing too, where it all just ties together. One piece of advice I would say is kind of just like trust the process. And it's not, like I said, it's not gonna be, you're gonna be fixed and better by tomorrow. Like everything you do is helping your injury and is going to make it better. And even if you don't think it is in that moment, it will in the long run. I feel like my time here was very, almost inspiring. Like it was just very helpful. It was kind of eye-opening to me, I would say. Amy is very caring, and I would say that because, like I said before, like she just makes you feel very heard. She wants you to succeed. She wants you to get better, and she's not just in it for her, like she's in it for you. She wants you to get back on the field, and she wants you to be yourself and be your best self. One of the experiences I had here was every time I was done with PT, I would always do recovery here, so they would always set up like a lounge chair for me, just right in the gym, and people would be doing their workouts and I would just be sitting in a lounge chair like doing the recovery boots or doing something for my knee, but I was just like there. Like I was just watching and taking it all in. And I was just like in a lounge chair and I was like, this just doesn't feel right. Like I'm sitting in a gym right now, just lounging around.
My name is Mary Jo Benalt. When it comes to my injury, I had been suffering for like 2.5 years, in and out of multiple physical therapy programs. And I saw like every type of doctor in the book, from my primary to specialists, with a pain in my left shoulder. And at first I was misdiagnosed 2 times, once with a tendonitis of the shoulder and then once with a bicep tendonitis that was running up the shoulder causing that pain there. I am a jiu-jitsu athlete and I was training 5 to 6 days a week at the time that I had started experiencing the symptoms. And in terms of its affecting that, I was really backing down a lot on my training and becoming very submissive to protect myself from any further injuring. Anything about like sitting up or pressure on this arm would cause like a sharp tingling pain. So I sat out a lot. I went from training 5 days to maybe 3, and then even some of those days I was sitting on the mats and watching versus training my full 5 days a week. Very competition-based training. When I finally had some relief was when I was stopping completely from training. That was really the only time I had relief. But also at the same time, I was finding tingling and numbness in my hands, and I was often dropping things. So even in my daily life, it was affected. At the time I was a bartender and I would like drop glasses or stuff, anything, even if it's not heavy. It was almost like my hand would go numb and just let go of whatever I was holding. And at this point, I really wanted to make a career change and get out of that business and into something more physical and, something more fulfilling. However, I knew that I couldn't really do much with this condition. So I met Amy on the mats. She had joined the team briefly and we really clicked at that time. We were, partners training. And when I heard that she was opening her own business, I knew already that she had a lot of knowledge and I loved her personality. So I knew that I would be able to be really comfortable sharing what's really going on and have no fear being like, this is going on, this is going on. And so I called her and I said, I'm still having that pain. Remember we talked about that pain in my shoulder? I'm still having it. It's been like 2.5 years. And she said, come on down. So I did. My first session with her, she did like maybe 4 little tests and said, I think this is thoracic outlet syndrome. And I was like, I never heard of that before and I didn't know anything about it. And then she did a couple more and she's like, I can't diagnose you, but I'm almost positive this is what it is. And I'm gonna send you to this doctor in Boston, Dr. Donahue, and he takes about 6 months out to book. So I booked it as soon as I could and I stayed with Amy for like physical therapy until I got to see him. When I got to see him, he confirmed it wasn't exactly that. So in terms of making the choice to Amy, it was really just a genuine connection that I had with her, and I knew she was really smart. In terms of continuing my care with her, it was that I had gone through multiple doctors and 2 other physical therapists that had completely given me 2 other diagnoses that I didn't even get better from. And this one, she sent me to the right place and I got a proper diagnosis. And once we started treating that condition, I started to see improvements. The other training programs, one of them was I was in their office maybe 15 minutes once a week. A physical therapist who would do just a couple, maybe like light massage work or like pinch and stretch, I think that's what they call it, on the area, and heating pads and stuff like that, and sent me home with very basic stuff that I was already doing and not improving from. And then when I went to the next one, it was the same thing, the same exact, I told them this is what I was doing and I'm not getting better, and they sent me home with the same exact exercises. Nothing changed and I didn't get better, but they had said, oh, this is it's bicep tendonitis, not, whatever the first one was. And so they thought if we just did it like based around a bicep tendonitis, we could change your results. And again, I didn't see any results. The manual therapy, first of all, you're in a session at Amy for a whole hour, every session. And when it comes to that, you're getting 1 whole hour of this manual therapy. During that, we would be talking and she'd be giving me information and sharing knowledge and asking me about mental health, physical health, how are you sleeping? All these things are affecting this condition more than you think, and giving me tools to improve those things alongside while using these manual therapies. So not only am I getting like a good care for the specific condition with hands-on, I'm also getting knowledge at the same time. First of all, we were treating my shoulder and my bicep in previous physical therapy, and in this one she's treating my neck, which is where this issue stems from. So if you don't know anything about thoracic outlet syndrome, it's a compression in the nerve and vein in the brachial plexus that runs under the clavicle and to my hand. So this area wasn't being treated at all prior. So as soon as she started putting pressure in these areas and doing the same like pin and stretch sort of massage techniques, but in the correct area, I would feel instant relief, like literally instant. And then when it came to seeing the right doctor, that's also like, and she put me there, you know, she's the one that put me there. And if I didn't have that, I would have never had this moment where I can actually get back to training and I'm not gonna have to sit out anymore. So I think doing the correct exercises and really strengthening these muscles surrounding that area, which were not firing prior, caused my body to actually change. And it's not just a temporary relief. And now I have these skills because the knowledge she was giving me, I have these skills for the rest of my life. In terms of strength and mobility, prior to my treatments, I could barely lift my hands to about here without feeling that tingling or numbness in the hands. And now I can go all the way up. I can hold things, I can lift things up without feeling any of these symptoms at all. When it comes to my training, I'm still working on getting back into a full-time, but that's for other reasons. But it's allowed me to understand what I can and can't do and what's gonna cause some tension on that area versus I was babying the wrong area in the past. So now that I know, okay, maybe we shouldn't do those inversions all the time and only do it when we need it. I can manage my symptoms on my own and I'm gonna be able to get back to competing versus I didn't think I was gonna compete again. Like I really didn't. I really thought I'm just gonna train for fun now and I'm not gonna get to compete. And since, you know, seeing Amy, I have like advanced up a belt. I went from blue to purple, which is a little higher level. So going into a competition, I'm gonna be going against really strong, really powerful women, and I feel like I can do it with confidence. There was no good sleep, and moving like laying on the side. She actually even gave me a position to sleep in, which I sleep in every night now. But laying on my side, waking up, it was so painful and achy on the shoulder as well as the neck, to the point where some days like there was little movement, like I was just stiff as a board. And yeah, sleep was awful. Like I couldn't lay in a certain position for, you know, more than a few moments without getting that tingling sensation in the arm, as well as like sitting on the couch was probably the worst one. So that's the time you're trying to relax and unwind, and I can't unwind. I'm getting this like pain that shoots down to the fingertips, you know, and this tingling sensation, and it feels like my arm has fallen asleep. In terms of mental focus, that's the biggest one, because my sleep has improved, and it's improved way more than I had ever expected. First of all, I didn't expect it at all, but my sleep has improved. I wake up sharp. I've gained a lot of confidence because now if somebody asks me like what's going on, I have all this information and I can share it. And if somebody is having some sort of similar symptoms, I can be like, hey, you should try this, you should try that, and then go talk to Amy because she knows what she's doing. And one thing that I would point out that I also didn't expect to gain is a friend. You know, she's always there, and I can text if I have like pain in the shoulder or anything, and you know, she's like, we can get you in as soon as I can or whatever. Or I need any information about nutrition that I have, you know, I have any questions, she's always there. It is not covered under insurance. So it is, you look at this and you see the bill and you're like, is this worth it, right? This is gonna be a lot of money. But if you think about it in long-term and future and permanence, you are gonna get the correct care. And if she doesn't get it on the first try, I'm sure she's gonna try until she can get it. And I'm 1000% sure of that. Versus I was other doctors that were covered under insurance and they were like, well, we just don't know. We can't help you any further. I've always been a fairly healthy person because I've always been an athlete, and so I've always understood the importance of it. If you aren't knowledgeable about your nutrition, Amy can set you up with that. And she is going to give you something that's going to be tailored to your needs, whether you want to gain weight, lose weight, get stronger, have a better cardio. She knows exactly what she's going to give you, and it's going to be specific to you and your needs. Powers Performance can be a family and a friend, give you everything that you need in terms of athleticism. She's just a joy to be around, but also I would say knowledgeable. She's very well-rounded in her knowledge. I feel like every session was hilarious in there. Are you kidding me? To be laughing? Actually, yeah. Now that I think about it, we would be in a session and, doing whatever dry needling and everything, and then Mike would knock on the door and basically being like, you guys are going over time. And she's like, oh, thank God he's here, because we'd be in there for 3 hours just laughing.
Ryan Atkin. So what happened, it was a week before soccer season began, my senior year. And I was at captain's practice actually, and I tried to plant to change direction and just tore my ACL right there. And it was really tough because soccer, it's been a big thing for me my whole life. And now, senior year, I wasn't going to be able to play, and that was really tough to kind of understand and really feel right then, especially since I had a great summer going into senior year, and I was really looking forward to this season because for senior year means a lot to everybody, especially when you're playing sports. And this group that we had been playing with all my life, we had a really strong connection, and everybody knew that senior year was the year that we'd all looked forward to, because especially the last 2 seasons we had weren't that great, and we were all just looking forward to having our senior year together and to have a good season. And instantly before the season even started, I lost that. Everybody I feel that I know that has had a similar injury like this has came here and has seen nothing but great results. And seeing that made it kind of obvious that I wanted to come here at some point and wanted to feel what they felt, because it seems as if that was really a driving factor in their recovery. I actually started at just one of the outpatient PTs that the place that I had my surgery through recommended, and it was not a good experience at all. When I got here, I believe it was 3 months after my surgery, and I was way behind where I needed to be in my recovery. And I play baseball as well, so my goal was to get cleared for the spring season, which when I got here I only had 3 months left until, and I was way behind where I needed to be, and I didn't know that until I got here because they weren't telling me that there. I didn't know that until the first time I got in here. She ran some tests on me, and she was like, all right, you're nowhere near where you need to be. We can get you there, but it's gonna be a lot. And it was, but she did get me there. The biggest thing was the personal touch. When I was at the other physical therapy place, I would never be the only person that my physical therapist was looking at that time. So he or she would always be walking back and forth from table to table and kind of just giving me 2 exercises, and then I'll be back in 5 minutes. So I just sit there, do my exercises on my own, and walk, and then they just leave. And there was really no help, and every now and then, even when I had something to ask them, they kind of you could tell they didn't really want to answer the questions that I had, or they had no they didn't care. They were kind of just there because they had to be. They didn't care. But it's a lot different here because of the personal touch. I feel a big thing with Amy is she cares just as much about the relationship with the athlete or whoever she's working with as she does their recovery. So she makes a big point, get to know the person and get to know their story instead of just kind of just giving them exercises and letting them go do their own thing. I just think it was really cool especially with the Plantiga, being able to see results and see what it is, because with other things, you can look at it and you can see what it is, but you won't really know until you get to see numbers on it. And I thought that was really cool, being able to actually see my progress and a physical results instead of just how I feel. The big thing for me was the first time I was able to really move freely without feeling any pain in my knee. And that was very soon after I stopped coming here, right after my sessions ended. Maybe halfway through baseball season, we had planned it so I still had a couple sessions during the season, but about halfway through the year is when I kind of really started to feel really good running around on my knee. And for me, that was I was whoa, wow. I didn't think, because I had gotten used to feeling a little pain, I didn't think I was gonna just go away. And one day I was running around and I'm wow, I feel really good. Well, for me, again, it was a lot of the the pain, because even originally walking I would feel it a little bit and it would kind of just get sore, and I just didn't I wasn't feeling good. And like over time, I like progressively felt it getting better and better and better, and there was less soreness and the pain was less severe. And especially when I was doing certain things such as jogging or running, like I could feel like less and less and less until one day it finally went away. And it was also big when I got here, there was a lot of atrophy still, and my legs, the muscles were a lot smaller than they should have been at the time. Seeing that kind of like go away as time went on being here was also really like big. I'm gonna be honest, for me, a lot of the thing, like I didn't know that much about like what to do, like in terms of just like working out in general, and being here kind of like gave me like information on like what I needed to do like physically, and even now I see she's been doing a lot nutritionally, and I think that's really good for people to pay attention to, because those are all really important things when it comes to bettering yourself in a physical way. It's definitely worth it. I mean, like you can hear it from me, you can hear it from anybody else that's coming in here and doing these interviews. We are all like firsthand examples of why being here is better than being somewhere else, because of the personal and because of the professional touch that she has. Like she knows what she's doing. She's not just like telling you to go do stuff and walking away, and she's with you the entire time that you're here. And you guys are, first of all, making connections, which is very important, and you're getting better. And it's not just like, oh, like I'm getting better, blah, blah, blah. I'm just saying that. No, like you like see results and you feel results. And that's why I think being here is so much more important than being at another place, because you're just sitting on a table and you're doing like the same movement over and over again, like week after week, and you're not getting anywhere. But it's here, you're doing different stuff every time, and it's actually getting you better. You will see and feel differences if you come here. For me, the biggest thing was kind of getting over in my head that like you can overcome anything, because when I first got hurt, I was all stuck over the fact like, oh, I can't play soccer this year, it's like the end of the world. And it was really tough for the first month or two, but then once I realized, especially when I got here, that like, all right, I'm gonna get over this hump, it's not the end of the world, I'm gonna be out there again, I'm gonna like do what I love again, like I'm gonna be there. It really like changed my perspective on everything, because now I know that there's like nothing that is too big, like nothing you can't like get over, no matter how bad you think it may be. I haven't always eaten the best, but I've kind of started to like make it a little like cleaner when I can. It's tough being at college right now because I only have so many options going to a dining hall every day, but I'm trying my best to like keep my like food, like getting like the right amount of like carbs and protein and all the nutrients that I need. It's like the perfect balance of personal touch and effectiveness, because like I've been saying, it's like for me, like the personal touch was huge. Like being able to connect with the person that's helping you and being able to like truly like feel the results at the same time are big, because I'm so like we would sit there and we'd have conversations while I'm working, and I'm not sitting there feeling like I'm just talking and wasting time, but I always felt like I'm building a connection and I'm feeling great. And I know this connection is not just like a connection that went on while we were here. I know that I not only have gained a connection, I've gained a resource if I do need that in the future, and I like won't hesitate to reach out, and I'm sure that no other athlete here would hesitate to reach out. Again, I'm gonna go back to effective, because it's effective in a like person way and effective in that like physical way, because as a person, I feel like she helped me better myself here, like whether it was just through like building the connection with her and like giving me the like things that I need to become successful, and in the physical way, she like helped guide me to becoming successful while building that connection in the like people way. I remember there was this one time I had just gotten done with a workout with the BFR, and my leg was just shaking uncontrollably for like 5 minutes, and we like physically could not stop it.
My name is Sophie. I'm from East Long Meadow, Massachusetts, and I play field hockey at Springfield College. A little bit of my story is this past summer I was in an adult league just playing for fun out there for ha-has, and I was running back and I planted the wrong way and I twisted and I heard a pop and I felt a pop and I just fell to the ground, and I was hysterical because I knew what that noise was. So I would say this summer I tore my ACL and I had surgery this summer as well. So that was a really tough injury to hear about having. Like I just remember getting the call from the doctor and just breaking down, because what it meant was basically all my hard work over the whole year of just like, when you get to college, it's really tough because you're all of a sudden a little fish in a big sea. And so being a freshman was hard. And I think my freshman year I've worked as hard as I ever have before at my sport, just to get stronger, more fit, better at the sport, more confidence. And I had felt like that injury just shattered all that, because here I was gearing up for my sophomore year, and I was like planning on it really being my year. And in a matter of 30 seconds, it was just ripped away from me. So how I found Amy was after we had found out I was injured. Obviously, my parents were also just as upset as I was because, you know, you don't like to see your kid upset or injured in any way. I just remember my mom was like, you know, I used to exercise with this woman named Amy Powers. I know that she runs her own physical therapy business now because we have a family friend that actually had their daughter going to Amy for some injuries like related to gymnastics, and they had nothing but good things to say about Amy. So I literally remember that night that we found out, we called Amy, and then within the next few days we were in here. I've actually never been through physical therapy before. This was my first time, but I can honestly say that Amy is very genuine and caring, and I feel like anytime I have a worry or concern with my recovery or whatever it may be, like, and I text her, she is so quick to respond. And like, I remember early on in my recovery, especially like those first few weeks, I mean, it is really dark. Like, you're in a brace basically, and that brace is huge. Like, your leg is literally out straight and you're on crutches and you're completely immobile those first couple weeks. And I just remember feeling so low. And I remember reaching out to her and texting her, and she would check in on me on a daily basis. But I just remember reaching out to her, and she was so good about the mental part of it early on, because it really is a very challenging injury, not only physically but mentally. So she was very good about making sure that my mindset was right before we continued on, because that really can stunt your progress. When I had surgery, I actually had a quad graft, meaning that they went into my quad and took a third of it out to repair my ACL. So you can imagine the pain I was in, you know, those first few weeks, the soreness, all of that. So to jumpstart my healing process, we actually used a lot of BFR, and that was basically just to kind of get my quad going and to get it to just start contracting normally again. And I think that really helped in the beginning to just jumpstart that strengthening process, because it's going to take a really long time to get back to 100%, especially in that leg. But with that, we were able to really see a lot of improvement in such a short amount of time by using that tool. Well, to begin, we did a lot of like basic, more like laying down exercises. So we did a lot of like laying down straight leg raises. We did a lot of like sit to stands with the BFR on. And then once I was transitioning into doing more like unilateral type exercises, we did lunges, we did Bulgarian split squats, we were doing like planks, we were doing all sorts of stuff with the BFR on, even like sled pushes. So you can really use it for anything you're doing or any type of training, which is really cool. And it was kind of cool to see that progress of how I progressed with using it, how I went from like such short little lay down exercises to like pushing, you know, 150 pounds on a sled with it on. So it was definitely like one of those tools that really help in the beginning, and we're still using it even as my recovery goes along at times. I think an aha moment was realizing that I wasn't going to get that strength back overnight, and realizing that it's really a long process. Like, I think I find myself on days like, you know, you have good days and bad days, and on bad days it's like, oh my God, can I just like be normal again? But you really have to pay attention to like the details when training, and I think once I started realizing that, my recovery has just gone a lot faster when I just bought into the process versus just like trying to rush everything. My overall well-being just by finding Powers performance has been a lot better. Actually, like the first couple weeks of coming in here, Amy was already recommending like different supplements to take to increase like, you know, muscle growth and stress and all that, because those first couple weeks were really tough. So it was like I'd lay in bed at night and I couldn't move in my bed because my leg was just out straight. So she, you know, recommended certain foods to eat to help decrease that anxiety at night I would have, and, you know, when the thoughts get racing. And also, like, I think nutrition-wise too, like she provides a lot of good advice on nutrition for healing as well, because a lot of healing, actually, I think what people don't realize is in your diet and what you're fueling your body with, and your body like physically reacts to what you're eating. So I think I never really paid attention to that. So I think that's definitely something I was surprised by after coming here that I have improved with. And then also just like paying more attention to my sleep and recovering. And I think a lot of people skip over that and think that if you're recovering or taking a day to do, you know, some stretching or mobility or any of that stuff, that you're like behind in your progress, but it actually helps a lot. So I think realizing that and accepting that is also something I was surprised by. And just like my overall confidence, because I think Amy does a really good job in instilling confidence in all of us, and even Mike. Like, I was at the gym the other day and I literally saw them, and like they came right up to me and gave me a fist bump, and it was like, you know, sometimes you just need that. I think in the beginning it's hard when you have an injury like this because you don't really know who to listen to, or, you know, I went here, I went there, this, that, and the other thing. It can get overwhelming. But I think Amy in the beginning was just so calm about it and was like, you know, I'm here for you. Even if you don't choose me for PT, like, I am here for you to help. And I think that that was like, okay, I really like her. Like, I think that she's really in it for me. And I think because it's cash-based, like, she carries a smaller caseload, so she really can be thorough. Like, nothing ever falls through the cracks. Like, I mean, again, when you have a major surgery, you're gonna have times where something feels abnormal, something feels sore. You're gonna have those moments, but like, she never ignores any of that. It's always like, okay, well, like, let's like nip this now so that it's not a problem later down the road. After coming here, I've realized that you should be able to have fun with these things too, and I think like all my sessions are hard. Like, I never walk out of here feeling like I didn't work hard. Like, she really does push you, and I think that I've taken that into like academics, you know, getting back to playing, and like other areas in my life too. Like, you really have to work for what you have. And I think that that's something that Amy really enforces in all of her athletes, which is great, because the work really is what you do on your own. You can't come in here for an hour at a time and expect that to be it. Like, you really have to do stuff on your own, and I think that she is like on you to do those things, which is great, because, you know, in order to get better, you have to put the work in. A sentence to describe my journey so far would probably be, I'm stronger than I thought I was. I think one word to describe Amy is genuine, because she really is genuine, and like, she really cares about you. If you walk in here, like, I've walked in here like on the brink of tears some days, and she is just automatically like can tell right off the bat. And it's like, okay, let's talk about it and then let's work hard. And like, she is willing to even go over the time that you have scheduled with her. Like, I've been in here for like well over an hour, maybe hour and a half, 2 hours sometimes, just by her like sitting with me and talking to me and just helping me through some of the mental battle as well. The first couple of weeks, I couldn't drive myself to my sessions, and it was summertime, and so like, you know, my parents stayed home for like a week after my surgery, but then like once it was time for them to go back to work, then my brother was kind of taking care of me, but he couldn't drive yet. So then my best friend from high school actually decided that she was gonna help out and she was gonna drive me to some of my PT appointments. So one morning she was planning on driving me to PT, and it was a 10 a.m. session. When my parents were home for that first week, we were kind of in a routine. Like, my mom would come wake me up, she'd help me out of bed, because at that point I really could not do anything. I slept through my alarm. I woke up to like 5 missed calls from my friend, and she was like, I'm outside your house, we have to leave, you're gonna be late to your appointment. Of course, I get up, I'm hobbling around my room, trying to get dressed, trying to like rush around. I didn't even eat anything, I didn't have any water, literally got in the car, and somehow we got here. And I walked in and I was just like a frazzled mess, like, you know, crutching along with my crutches. Actually, that was the day that Amy decided to use BFR. Now, BFR is basically blood flow restriction. So she decided to use it, and at first we were doing a couple lay down exercises, so I was like, okay, I'll be fine. Like, my PT's not that intense yet because I can't really do a lot. Then we start doing squats with the BFR on. This is my first time like squatting, just to a box and back up. And with BFR, the first set has to be 30 reps. I did the first set, and then I sat down, and we're talking and we're laughing, and all of a sudden I just start seeing spots. And I was like, oh my God, I'm gonna pass out. So I say to her, I don't feel so good. And then all of a sudden I just like fell back, and she caught me, and then she like threw my legs up on a mat and acted fast. But like, I just remember getting in the car after, and my high school friend was like, I didn't think you were doing a PT exercise. I wasn't really sure what was going on. But like, moral of the story was, I learned that PT is a workout, and you gotta fuel for a workout when you go to PT. So it's definitely a funny story, like a beginner's mistake type of story, but definitely a lesson learned there to make sure you don't sleep through your appointments or not eat anything before you come here, because it's tough.
My name is Tim Boudreau. I'm 19. I'm from Wilbraham, and I graduated from Minnetonka in 2023. And I got hurt in the winter of our senior year. And it was playing rec basketball. So I was playing rec basketball, not even a sport that I play. It was not my main sport. I play football and lacrosse. So I got hurt and so I dislocated my knee. So it was, I think the medical term for it was a posterior lateral corner injury. And so I ended up partially tearing or like completely tearing all the ligaments in my knee and my meniscus. I had some like injury to my calf and my hamstring too. After that, that was pretty intense. I was in the hospital for 2 days. They had to relocate my leg. We had to go into surgery for that, but it wasn't like an invasive surgery. It was just because I had to put me under for it. They got me braced up and then I left, and that was definitely a big change, like a big change to a daily life, just because, you know, you can't shower for 2 weeks after you're done. I couldn't shower. Getting up off the couch was hard. I remember my mom would have to come and like carry my leg for me off the couch whenever I wanted to get up to go to the bathroom, and it was just different. It was hard, but you know, slowly started being able to, like, getting used to it basically. And then so went back to school. I actually was in a wheelchair the first day I went back to school. I was in a wheelchair, and but that didn't last. I was in crutches the rest of the time because the wheelchair was not easy to get around in. So I ended up going to the prescribed rehab that they told me to go to, which was the Bay State rehab, and I was doing that for a little bit. So actually I had 2 surgeries. So my first time in the hospital, and then they scheduled the first surgery, which was everything but my ACL. They were going to reconstruct. So I was doing PT for that, and it was basically just like bending my knee. That was all I could do really, because they were going to do 2 more surgeries, so you can't do a lot of like strengthening. Obviously my knee wasn't even supported by anything. And then so I was doing that, and then my first surgery, and then I went back to the same PT, and I was doing the same stuff I was doing before. I knew in my head that I wanted to go on to play club lacrosse in college. So I knew that going back to this PT and just doing the same, like, oh, go on the bike for 10 minutes, ice it, go home, it wasn't gonna help me at all. Like I knew that I needed something different, and I knew it was the PT. I knew I just needed to go hard with the PT, and so we started looking for new places. Every place that we went to was booked for like months and months in advance, so we couldn't even get into a place for so long. And actually, a kid we play lacrosse with, his mom knew Amy from in town, you know, just in Wilbraham. She recommended her, so my mom called Amy. I remember she came in, I think it was after they were closed. She had to let us come in and do a consultation real quick. That was the first thing that stood out in my mind about her, was like, okay, she really cares, because, you know, it's one-on-one consultation. She's heard about the injury, and she wanted to see me and like make sure that I was getting the right care. Then we made a plan. It was like, I don't know how long. It was a long time, but we made a plan, and then I think I was here twice a week for the first month or 2, and it was intense. It was like, yeah, just more than I had expected at first, to be honest. But looking back, I'm glad I did it, because I was leaps and bounds ahead of where I would have been if I had stayed at the other PT place. We did the BFR, that thing is crazy. The blood flow restriction, there's the leg press machine over there, so we would do that, and not even any weight on it. Maybe like the resistance of 1 band, and it made it feel like it was like you were squatting 200 pounds. Like, it was insane. And doing that every day, like every time I came in, doing 10 minutes on the bike first with the BFR, and just like, you could really tell it was working, especially going home and being able to like, okay, I'm walking now, and I'm able to do this confidently. I can tell that it's working, and it was definitely the right decision. Any questions I had for her, I would message her on her app that she has, and answered right away. Every time I came in here asking her questions right away, you knew everything. And you know, you go in to see one physical therapist, but they have 5 different patients while you're there, and it's more of, I was the youngest kid there. Everybody else that was at this PT place was, you know, over the age of 50, and just like, okay, like you can walk, you can go up steps now. Okay, like next person in line. That was really it. And I was like, okay, I want to do more than that. That's when the search for a different PT started, and Amy was the only person that would let us come in and even like talk to her. Like every other place that we looked at weren't even taking people because they were so booked.
My name is Nick Boudreau. I'm 19 years old. I graduated from Minnetonka Regional High School, and this is my twin brother Tim. And we both had to go through ACL tears at the same time, pretty much. My injury happened 3 months after his injury. I had seen him go through the whole first 3 months of the process, so he was already here. He was already recovering somewhat before his second surgery, and I was playing lacrosse, and I wanted to play club in college, and it was in the playoffs. It was right at the end of the season in May, and I think it was our first or second playoff game against our rival school. I played for Minnetonka, and we were playing against Longmeadow. It was early in the game, first or second quarter, and I wasn't even doing anything crazy. I was chasing someone who had the ball, and I took a plant step, and I instantly knew something was wrong. My knee I felt a pop in my knee. I went down, and I remember like the trainer was like, oh, it's probably not an ACL tear, like you're probably fine, because it didn't hurt honestly as bad as I thought it would. I was still a little hopeful that I was gonna be fine. I was like, dude, there's no way that I just tore my ACL or did anything bad. I just like let it rest for like the next day. That's when like I went in to see the physical trainer again. Like after that, like I didn't even have school. I think I was like went in on like a day that we didn't even have school, and she was like, yeah, this does not look good. My knee was huge. It blew up. Like it was all jiggly. Like I couldn't even walk on it. She had to give me this like the school brace to use, and it was just like this cruddy brace that like was falling apart. And so then after that, I went to the doctor. They did x-rays, and he instantly knew that I tore my ACL. And so like after that, I was kind of like, wow, like I really just did the exact same thing that my brother did. And it was crazy because the timing of it happened to where his ACL surgery was the exact same time as mine. Like I think his was like 3 days before. So I had already known, like going into this, like, okay, I'm gonna go do Powers Performance physical therapy. Like that was in my mind because I knew what they had done for him, and I knew that I wanted that same thing. And I wasn't gonna even try and do anything else because I already knew that this was gonna be the best option that I had. I was pushing him around in his wheelchair on the first day that after he got hurt, and like I was helping him move around the house, and then all of a sudden, like a month later, he's walking around, he's bending his knee, and I was like, okay, I'm gonna do the same thing because I've seen how well it worked for him. I'm not in good shape now, but I know that I can be where I wanna be if I just stick to it and come here.
So really the biggest difference that I would say between the two different physical therapies that I did was the attention that you get from your physical therapist. In here, it's one-on-one for the whole session, and you're the only priority. You're really getting the full attention, the full what you want out of your PT. And when you go to these other places, that you get it here.
So the BFR is definitely, I think we can both agree that the BFR, it sucks, but it is so good for recovery, and it's so good for strengthening your knee. Like we would come in here and Amy would be like, all right, we're using the BFR today, and it would instantly just be like, oh no. Like I knew I was breaking a sweat. Like, and you would put it on, and you'd go on the bike for like 5 minutes, not even on a hard setting at all, and you would be just sweating, you'd be tired, and you could feel the difference like in your knee using the BFR and not using it. It made such a difference that it was like crazy. And same with like the Plantiga, it made it so easy for us to track our progress and see exactly what we needed to work on every week. So we could come in here and she could figure out, okay, this is your weak point, and you're fine with this part, but maybe you need help with like jumping or like stability on when you're decelerating. And she would give us specific exercises for that thing to work on. That way you're not repeating something or doing something like, if you're good with the acceleration force, you don't need to keep like going really hard on that. Maybe you need to focus on something else. And that technology made it so easy for that it definitely like sped up our process for sure.
Part of the treatment that we got here was Plantiga, and so what it is the soles that you put in your shoes, and it has sensors in it. It like monitors the pressure basically. They're like throughout the exercise, so you'll do like running, jumping, like we did skipping, like it was a lot of stuff. And it'll track it every time you do it, it monitors like your progress, and you'll see what you improved on and what you didn't improve on.
She would print out the papers for us and like hand it to us, and me and him would compare our stats on like which one, like who did better on what thing. It made it a lot more fun for us, like, and even though it's not fun, that competitiveness like made it something where we could enjoy coming here more.
And I would say it was encouraging too, because you're seeing your progress, you're seeing how much better you're getting, so it's like encouraging, like, oh, like I am actually improving. And then eventually you see, oh, my affected leg is better than my left leg.
Yeah,
like, okay.
That happened to me at the end too, where like my right knee ended up being, oh wow, like it's significantly stronger like than it used to be, and stronger than my left leg was. So
my aha moment wasn't so much for recovery, but there was a moment when I had been at school and I was doing the exercise on my own, and me and Amy were doing video calls to, see how well I was doing. Like, okay, here's some exercise for you to do while you're at school. It was right when I had come back from school, we did a checkup appointment, and Amy I think it was both of us, she sat us down and said, okay, listen, like, if you want to be recovered for your spring season at UNCW is where I was going, and play club lacrosse there, you really need to like dig your heels in and like work harder, because right now you're not right where you need to be. So I remember that moment being like, okay, like I need to really like start doing more there, because at school it was hard, you know, not really doing the exercise I was still active at school, but not really following the plan that Amy had made for me. She tells you how to do it, and you know, you just gotta follow the instructions.
She's honest with you. She's like, oh, you're not gonna be able to do it if you don't stick to my plan that I'm giving you.
Yeah.
And she makes it known, like, hey, I'm giving you this plan and you gotta be really strict with it if you wanna be where you wanna be. And if you wanna play sports again, she can tell you to do everything in the world, but if you're not actually doing it, you are gonna fall behind and not reach your goals. And she is very, very adamant about following the exercises she gives you. And she would send us videos, like she has the app, and she would send us videos of exercises and how to do them. She would always be texting us, asking if we had any questions about anything, constantly giving us new exercises, anything that we needed. The first time I noticed something was when we were doing like the sprinting training, and we had done it a few times before just in here, and we wanted to do it again, and we went outside because it was the summertime. And I remember I was running, and I was like, I felt for like the first time since getting injured, my knee felt really, really strong while running. And that was like kind of a big deal for me. Like it gave me kind of a big confidence boost. Like, wow, and Amy and Mike were out there, and they're like, wow, that looked really fast. Like, and that was a big like moment for me, just because like it feels good to know you're doing well, and like it felt good. And that was like the first time that I'd ever noticed like, wow, like I really have come a long, long way from where I was. I went to the tryouts, and I felt just as I did, like the same as I did before. I mean, my knee was getting like sore just because I don't even think it had been a full year by the time I was trying out for lacrosse again. Like it still hadn't even been a year, and I was already sprinting, and I'm running next to these guys who have never been injured before, and they haven't had to do any physical therapy. They've just been playing straight through high school, and I'm running next to these guys, and I'm keeping up with them. And that felt really good for me, knowing that I wasn't even a year post-surgery.
As far as improvements in my overall performance, just knowing where I came from, and okay, like walking through school in crutches, and you know, because obviously I would go to the lacrosse games still, and being like seeing kids like running, and be like, man, I cannot picture myself doing that like ever again. I was like, how am I going to be able to run again? Like running, like I couldn't barely even like walk without my brace locked out straight. And then just coming through here, and just even within the first couple months I was here, I was already like able to walk like strong, like confidently walk without my brace. My injury was a little more intense, so during sports I was still doing the PT plan that I had and making sure that I was getting the right recovery, but still, like Nick said, I wasn't even a year after I had fully dislocated my knee, and I was playing lacrosse with these kids who were completely healthy, and it was definitely a confidence booster to be able to see myself doing that, like keeping up with these kids.
Some of like the unexpected things that I get from this is like, I didn't think about it a lot before, but like working out and doing exercises, like I learned how to use proper form on a lot of like lifts that I would do in the gym. And even if it wasn't like a part of my PT plan, that was just something that I could talk to Amy about, and that she is very knowledgeable of, and she would tell me how to do all these exercises that I still use, even though I'm not doing like a recovery plan anymore. I still use the exercises that some of the exercises that she gave me, purely just because they build strength in my knees, and that's what you need. And even if I'm not, like my goal isn't recovery anymore, it's just now I'm just going to the gym, like being healthy, but now I can still use these same exercises and use proper form, knowing that I'm not gonna get injured again if I keep doing it the right way.
I would say the same thing, just the mental, more of, obviously, you know, my knee got a lot better from going here, but being in the mindset of like an athlete, and seeing Amy and Mike especially, you know, because they go to the same gym we do, so seeing them there and coming here and ask them about, like Nick said, just general like workout knowledge, and then you know, you go into her office, you see all the medals and all that, and it's like, okay, you get into a mentality of like, okay, like that this person knows what they're talking about. If I just follow what they say, like I'm gonna be fine. And then I felt myself getting more motivated to actually improving, like just going to the gym for general health, and not just like going to the gym to just go to the gym, but you know, wanting to go there with a purpose, and seeing like all the progress that I've made, and again, like strengthening my knee, like all those exercises.
You're paying for a expedited process almost. Like, if you think about it, if you're going to a regular PT place, most likely you're not going to get this kind of treatment, and your recovery is going to take that much longer. For his case, he started that Bay State PT or whatever the one that was prescribed him was, and the progress is just so minimal. And when you come here, you're instantly in the fast lane, you're instantly doing strengthening, all this other stuff to heal so much faster. If your goal really is to return to sport, you need a better process so that you don't get re-injured. She talks about all the time people who have not recovered all the way, been cleared from other physical therapy, go back to sport and instantly re-injure themselves. With this, she's not letting you go out there and play your sport again until she knows that you're fully recovered. And a lot of the times she's able to do that just as fast or faster than another PT is able to do that. And if it's safer for you to play again, it's definitely worth it.
If I had stayed with the PT that I'd gone to, they most likely, as soon as I was 50%, let's say, and able to walk, able to, like, they see me running, okay, you can go back to sports with a brace on. If your goal is to play sports, come in with the mindset of, I'm coming here to be able to play sports again, because that's what makes it worth it. If you come here and it's just like, I don't really, like, I guess I have to go to PT today, and then you're not doing your exercise outside of it, then you're not gonna get the most out of it. You gotta make the most out of it yourself. You have to put the time in and really spend time doing what Amy teaches you to do. And that's just how you're gonna get the most out of it.
Say you're in high school and you want to play high school sports for the rest of your time there, like you don't have time to be dilly-dally and doing other PT and taking a long time to strengthen up and get ready to play again. Like, you want to be done as fast as possible. Like, nobody wants to be recovering for 2 years or a year plus. If you're paying to come here, you're going to get the fastest, the best treatment that you possibly can get anywhere around here. When I first started here, I obviously followed the Instagram, and if you follow the Instagram, you can see that she's always posting the nutrition stuff, workouts, like all this good stuff that outside of just like basic like strength recovery, nutrition is also a big part of that, and she really pushes for eating healthy, and she's always posting her meals and what she's making for her kids, and it kind of inspires you, like, oh wow, like I can do that too. Sometimes she'll even post the recipes and you're like, okay, let me click on that, like it all looks so good, like she makes it look good for you.
Isn't she making a nutrition book? I'm pretty sure she's making a nutrition book. So you can tell, she's interested in it.
And it inspires you, like you see that and you're like, wow, I can do that too. And I know that we started doing more like meal prepping stuff after coming here and eating cleaner and really trying to maximize our recovery, and not just in terms of like working out and like going to the gym, but also the other side of nutrition, which she is also super into and very knowledgeable of. Like, you can tell that she knows what she's talking about. And she was telling us all about the supplements that she takes, and she put us on to like a bunch of these good supplements to help recovery and strength and all that stuff.
And with the supplements too, I think she has a partnership with Thorne, I believe, supplements. So she told us once we were leaving, hey, if you ever need a discount with these supplements, I can give you the discount, because even though you're not doing PT here now, you're part of the system. So if you ever need it, so I remember buying some supplements from her at a discounted rate. Going from from playing the sports you love to, okay, this is I wasn't able to play sports my last half year of my high school. I was a senior and I wasn't able to play. So it was emotional, but then hearing Amy talk to you with the confidence of, okay, we're gonna get you back like 200% and you're gonna be you're gonna be dominating on the lacrosse field. It encourages you and it makes you see like, okay, yeah, like it sucks now, but over the long term, I'm gonna be right back where I was, hopefully better than where I was, when I got injured. And so having someone have confidence in you and being able to see that every time you come in, it definitely does help with recovery. Just, coming in here and wanting to give 100% because you don't want to, disappoint Amy or Mike and be like, well, I guess I'm not, I didn't really do what I could, You want to come in here and not disappoint. So that definitely helped.
I know a lot of people probably don't get to experience, but we see them at the gym. Like, we see them working hard, and it makes it seem more like her words have more weight to it when she's saying it to you, like, oh, you need to work hard, but you can do this, and you see her out there doing it, and it's inspiring, really.
Yeah. One sentence would be, how much you put in is how much you're gonna get out of it, really. Dedicated. You can see it just with how she treats you, from physical therapy to, you can see it from she recently just won a bodybuilding show. You can see that. Like, that's just incredible. Just, yeah, dedicated, I would say, 100%. Like, easy.
I would say motivational. Like, you see her and she's always uplifting you. She's bringing you up. She's always saying, okay, next step, next step. It's always looking forward. It's always, what is something else that you can do to improve your recovery? That's that motivation that you need when you're in a time like that, when you are injured and you're down and you can't play your sport, you can't do whatever, like you can't physically do whatever, and she's out here telling you you can. And that makes a big difference in terms of like motivation in your own head. Like, there's some funny moments, and this is going back to like the BFR and stuff like that, because it's always like,
yeah, it always rounds back to the BFR. The BFR is crazy.
I just like, I'll be in here and like our appointments would be back to back, and so one of us would come in here first, and there's a specific time when I had done a super intense workout with the BFR, like probably the most intense workout that I had done here, with like a ton of like jumping, and like I think we were using the sled and pushing the sled back and forth, and Tim comes in here and I'm dripping sweat, like they had to give me a towel, and I'm like, oh Tim, by the way, like you're in for it today, buddy, like, because I knew he was doing the exact same thing that I was about to do.
I would say, yeah, definitely.
And I was like excited for it. I was like, I really want to see him do this now.
I would definitely say that, yeah. Because coming in, like literally 5 minutes before we switch over, and just seeing like defeated, just like dripping sweat and just exhausted, like.
And every time, like, no matter who's coming in second, you're seeing him, like, you're seeing the other, like, when I would come in second, I'm seeing, like, his, like, last 5 minutes, and it kind of, it's like, you got to prepare yourself after you walk in and see that.